Welcome friends to CNS Viewpoint. Like every day, today again at 5 p.m. India time, we are here connecting with you all, sharing some of our thoughts on something which we found very thought-provoking. And the news which we have for you today is about Lucknow in India, where the local administration has said that they will use COVID resources for control of dengue and malaria. When I read this news, I can't help but think the other way around. It is almost like 1 year and almost 1 year and 9 months now that since the COVID pandemic had begun in end of December or January 2020. All non-COVID resources were utilized, leveraged, or made available for in COVID response. So for example, when the COVID pandemic had peaked in Lucknow, the biggest of government hospitals such as King George's Medical University, Dr. Ram Manohar Lohia Institute of Medical Sciences, Sanjay Gandhi Postgraduate Institute of Medical Sciences, and others were fully converted into COVID hospitals. When we know that these are the very hospitals which are flooded with patients even before the pandemic, even before the COVID pandemic began. So these are the very hospitals where a lot of health care is provided for range of health conditions, not just for people of Lucknow or Uttar Pradesh, but people of several other neighboring states and maybe other countries also. This is the situation. So we had no choice. We were cornered, and this was a reality check on the disease prevention preparedness we had, in kind of disaster preparedness we had, and failure to even prepare for very basics of health supplies such as oxygen supply. Although we know that like when COVID pandemic began in end December 2019 or early January 2020, the evidence data from several countries in the world showed that oxygen can play such a key life-saving role for those who might need it. Although very few will need oxygenation, but those who need it, it will be really life-saving or could be very life-saving. So we knew that this is one of the basics of preparedness which we had to do, but we all know the sad story where people may not have died out of the coronavirus, but they died because of failure to have uninterrupted oxygen supply, which was so essential to keep them alive. And several other very basics of health services were not possible to be made available for each one of us, and that is why we lost so many of our loved ones. So this is a reality check for each one of us, that our preparedness to meet any kind of infectious disease disaster, etc., was really appalling, not just locally in Lucknow, but also in Uttar Pradesh, in India, in other countries in the world. It was not up to the mark, and these are very important lessons. So while we pat our back to celebrate the role of frontline health workers and our governments have played during the pandemic, and the advertisements all across the city I am currently in, that we have to thank our Prime Minister, okay, but what about the lessons, Mr. Prime Minister, and what about the lessons our government about stronger health systems? Do we want health systems so fragile that in events of dengue or malaria outbreak, we need to divert COVID resources to control dengue and malaria? Why can't we have sufficient human resources, laboratory type of other kind of resources, fever clinics and others for all kinds of illness? Why can't we have integrated responses to health instead of having to choose which is a more important priority right now, and the rest of the things can have to take a backseat? Why do we have to have play God? Who gets to live? Can we play God? That who gets to live? Should a person with dengue or malaria get care, or the person with COVID get care? This news was very shocking. And another news I read today was published in Daily News Activist Hindi newspaper, and it was about local residents in the city I am in currently wondering that every year in the same months we get a dengue and malaria outbreak in their locality. So what is the surprise? Why was not things prepared adequately and in advance? Can we be better prepared for management of preventing outbreaks and preventing infection? Can infection control, disease prevention also take precedence, or just curative or industry propelled kind of skewed priorities will guide us? Why has prevention not been center stage when it comes to health promotion? So friends, with these thoughts and with the prayer that we all may have health services as a matter of human right made available to each one of us, and we never have to choose anywhere on our planet whether someone should get health care or not. COVID or dengue or malaria or prevention of different diseases and infections, or a healthier lifestyles like safe spaces for walking, cycling, physical activity, and diet, for instance, healthy balanced diet, etc. Like, we know how to stay healthy. We know there's enough evidence on that, but we need to walk the talk on that evidence so that it translates into public health and social justice gains. Let's keep equity, let's keep justice center stage to all what we do. With these thoughts, let us conclude CNS Viewpoint today, and tomorrow again we will be connecting with you on our thoughts on something else. So see you all tomorrow. Bye bye till then.